creating noise and focusing on their own ego. If you're a serious health professional that wants to be successful in a business space, don't make crap up. Actually look to solve problems. Bring your clinical expertise, bring your loves, your desires, and your drivers, and look for ways to blend that together to seek impact.
Welcome to Ex Phys Biz with me, Aaron King, a podcast for exercise physiologists and health professionals wanting to grow and scale in business. Welcome to another episode of Ex Phys Biz with me, Aaron King, and I've got with me accredited exercise physiologist Nicole French from Exercise for Rehab and Health and Essendon Physio Group. So, Nicole, welcome to the show.
Thank you. Thanks so much for having me. I'm very excited to be here and have a bit of a chat to you.
It's great. I know I'm not going to do your introduction justice because I know that's where you started as an accredited exercise physiologist, and now you've got a multitude of things going on. So do you want to expand on the intro that I just gave you a little bit? What's going on with yourself at the moment?
Yeah, my pleasure. What's going on in my world? So, as you correctly identified, I am an accredited exercise physiologist and the very, very proud founder and chief vision officer at Exercise for Rehabilitation and Health and Essendon Physio Group, and also now the Melbourne Vestibular Clinic. So, a great range of multidisciplinary services really set up to help support specialist care for people in our community. In addition to the work that I do in private practice, so these are all private practices under one roof in Essendon, in Melbourne, Victoria. I am also a director of the Primary Care Diabetes Society of Australia. I am an ambassador for the Girls Uniform Agenda. And I have also done a lot of work in the postgraduate lecturing space as well, which I'm taking a little bit of a hiatus from at the moment as we put more and more research and more resources into our private practices to build out these specialty services.
Yeah, well, I knew that I wouldn't be able to do that justice as I said. There was a couple of things that you said there as well, which I know that when we first met each other a number of years ago, you were going down that path. You were talking about the school support and the uniforms and things like that. I personally found that interesting, mainly because of my own situation. Like I've got a daughter that's super sporty and sometimes wears dresses, and it inhibits their level of activity and things like that. So I guess, how did you come across that one? Let's start there. So how did you go down the path of supporting girls and their uniform choices to get them more active?
Love it, love it. Well, the first thing is research actually supports that choice for young girls, so girls in primary school and secondary school. Research supports that girls that have choice in and around wearing pants and shorts actually become more physically active at school. And evidence does tell us that if wearing restrictive clothing like dresses, for instance, it will reduce our ability to be physically active at school. And for girls, that's really, we started to understand that that's developing habits that become lifelong habits for physical inactivity. So the girls' uniform agenda was actually supported or started by Simone Karras, who I actually went to high school with. And Simone's daughter felt really challenged by playing football in her school dress. So Simone took it upon herself to start to make change. And as I started to see this evolve in the community, and as I started to see her working really hard in that space, I wanted to add voice to that. And I wanted to add exercise physiology specialty to that and add a health argument to that about how denying girls to wear pants and shorts could actually be setting them up for increasing risk of chronic disease later in life. So I joined the efforts of GUA, and over a period of years, we've actually established legislative change all across Australia. So there was national reform in that space.
Oh, that's amazing. I was actually having that conversation with one of our athletes here, because I'm at Fit Clinic when I say here,
Yeah.
about that in the space. She's a teacher as well, and she's she's got CP, and we're working with her for playing CP football. And we're actually just having a general discussion around, the kids at school. And she actually
Mm,
got her mother when she was younger to sew her dresses into shorts because she was able to have that, and the school supported her doing that. So she's now playing for Australia in CP football, and that's been part of the journey. And the current research around elite athletes and injuries, like ACL injuries, are slightly higher in female sports at
yeah.
the moment. And part of that, like, there's evidence around, maybe there's some genetic component, but I think that's probably lower impact compared to just the lack of loading support, just that low
Yep.
level loading and increased in just movement day to day. Like, society has set up young males, teenagers, with strength and conditioning programs and doing sport and rough and tumble and all of these things,
Yep.
just that day to day low level loading, strengthening the tendons, joints, strengthening everything, and just leading down that path. So then when they become elite, they've got decades almost of experience of just
Yeah.
playing sport and impact, and built up the integrity of their bodies, where females haven't historically had that opportunity to do that because society or culture has led them down a different path of. So anyway, that's my rant for today. So I'm with you on this one.
Couldn't agree more. Well, we're on the same page with it, aren't we?
Yeah, no, I'm all for that. So obviously, I
So,
love chatting to people that are doing things a little bit differently and have a bit going on to show allied health in general, and also EP specifically, of the different kinds of path that you could take. Like, you've got obviously that as one of the things that you're doing at the moment, amongst a
yeah.
multitude of things. So tell me a little bit more about the exercise for rehab and health, and also the Essendon Physio Clinic. You mentioned, like, how did that come about? I think the exercise for rehab and health was first.
It was. So that was my first baby business that I started. I started that business 17 years ago. So we've been in business for 17 years, and from pretty humble beginnings, a whole $110 I had to start that business, which afforded me enough cash to pay for my first session of rent, which was 4 hours out of a traction room at the back of a local physio clinic. It also afforded me a piece of TheraBand and a Swiss ball.
Wow.
Um, yeah, and that was it. That was it. And I had paper, like a white folder. I remember it vividly, with the grey lead that we would make the bookings in. And you are going to laugh at this, and anybody listening to this is going to call me a dinosaur after this. Um, I borrowed a computer because I didn't even have a computer. I had a word processor before starting my business, which didn't have internet. So my mornings were about booking the ideal position in the local library to use dial-up internet on their computer, so I could research, so I could understand what was going on in the world around me. So I could learn and develop resources as well. So I had my paper, my little paper folder, and my dial-up internet down at the local library. And I think one of the really cool things about starting from such humble beginnings, it can only go up, right? It can only get better from there. So, and I just worked my butt off. So I started with 0 patients, 0 referrers. I stepped out of a hospital job. So my first couple of years were in hospital. So it was a great experience because it was multidisciplinary. So I got to see what OTs did, what physios did, what speeches did, what pain specialists did, and how different models of care could be brought together to really look at optimizing outcomes for patients. And I thought that was really cool. And so when I started, my business, I was a sole trader and it was just me. Um, One of my first tasks was to go around and get the message spread that there was an exercise physiologist in the area. So, Aaron, in my first year, I'm very proud to say that I had visited every single GP and medical practice in the northwest region of Melbourne to tell them all about EP and exercise physiology. Not many of
Yeah.
them had heard of it. Um, and the MBS items for EP had just landed as well. And I didn't understand any of it, of course. I was just like this passionate, 23-year-old chick that wanted to change the world. So I went into private practice not knowing how to charge or not knowing what rebates were available. And I thought it was great that people could get a rebate, and it had just come in, but we were still using the triplicate forms for people to sign and mail in and all that sort of stuff. Um, but, news spread fast about the power of exercise and what properly prescribed exercise could do for musculoskeletal patients, but for people at risk of chronic and complex injuries and conditions, and for people living with them as well. And it was in my first couple of years that I really felt quite drawn to diabetes, and we can talk a little bit about scaling that side of things a little bit later on. Um, but business started to grow. I was lecturing at night time as well to try and get cash flow to actually feed the business because I wasn't seeing many patients at the start. And meanwhile, I was bulk billing as well. We can talk about that another day. Um, but I needed to supplement my income in order to pay expenses so I could keep the business afloat to see people. But things grew over time. And then I started to hire my postgrad students when they finished and opened up satellite locations and did that for a few years. Um, and by about year 3, I started to identify a real gap with our business. And that was actually not really being able to service acute injuries. And I wanted to help the whole person end to end across preventative, across acute, across long term. So I started working with a local physio who just so happened to be my husband.
Was he was before that or
You know what? He wasn't. We got married after we started our next practice together. I had to test the boundaries there in his business acumen first
uh,
before I married him.
if you
Um,
can make it in business together and not kill each other, then all right, that's a tick box.
100%. But you know what? We started to cross refer. Um, and it was like magic. And we were able to treat people across a whole spectrum end to end, which started to evolve into this dream. Um, and after some cross referral and some great outcomes, I started to relook at the structure of everything and went, you know what? I'm at all these satellite locations running around Melbourne. I don't have a place to call home. I don't have my one administration team answering the phone saying things I want them to say. I don't have my branding up. I don't have my patient pathway set up how I want it to really demonstrate the level of care that I want the people that are choosing me to come and see. So about 3 years into the journey, I made a very bold decision. I shut down all my satellite locations because we were in medical centres and leisure centres and I had about 9 of them all across
Oof,
Victoria.
that would have been tough.
Oh, it was tough. And the downtime, like the wasted time traveling to all of those locations. Nothing was electronic. So record keeping was pretty poor. And I just didn't want it anymore. So I shut them all down and I bought a building. I bought a building. Um, and then I decided that if I was going to do this, I was going to do it right. And so I brought Peter into it and I said, you know what? The world is not quite ready for our collaborative care yet. It's not ready. So you know what I reckon we should do? Open you a physio clinic, but let's do it all under one roof so we can do the beautiful collaborative care, but we're going to need to rebrand it as an EP clinic and a physio clinic. What do you think? He said, I'm in. So we did. So we started Essendon Physio Group, and it has gone from strength to strength with the collaborative care model. It's amazing.
Yeah, that was interesting that you identified that the world was not ready for an EP first clinic, and you just checked your ego at the door and went, well, what's going to get the best result for us trying to grow the business and also see the most people? And yeah, checking your ego at the door and saying, well, this is how the market sees it. Even if I disagree, this is how the market sees it at the moment. So accept that
Definitely.
that's how it is and then make change from the inside. Like, I think that's the
Yeah,
important thing is once you see people, like people don't know, even for me, like, oh, you're a coach, you're a trainer, you're a PT, you're an EP. They're like, everyone's going to only understand it how they see it and what their level of education around allied health is and what each person is. So I don't really care what I get called at the end of the day because if they say, oh, I'm looking for a PT with shoulder injuries or something. I was like, yeah, you're looking for an EP, but obviously you don't know what that is at the moment. So
Mm.
once they come in and you see them, then you can say, oh, by the way, we're also EPs, like, and this is the
Yep.
difference and this is the similarities and how there's some crossover or how there's some differences. And we probably do that same with the all other allied health professions as well. Like there's some gray area in physio and EP, and there's some areas that some physios and some EPs will be more specialized in as opposed to each other. But that's just
Most definitely. And at the
how it
end
is.
of the day, we're about the outcome and the journey for the patient or the client, coming through. And that's what we have that fixed gaze on. And we're about the long game. So, however it was going to start, it doesn't really matter. Let's try it. Let's test and measure it. Let's support it to grow its own wings and evolve. And we just nourish it over time. And wherever it goes, it goes.
Yeah, absolutely. So you've got a lot of things going on. Obviously, you don't have the time to do it all as a practitioner anymore. So you're
Mm.
not in a practitioner role anymore. And how did you go from being a practitioner all the time to now none of the time? Because that's a hard
Yeah.
journey for a lot of business owners and people is how to transition out of it. And I assume at the start, just like myself, like everybody, oh, they want Nicole to see them. You know, they want the person, even though you might not be the best person because you've got a million things going on in your brain, there's actually better practitioners than you. I'm not saying there are better practitioners than you, but I'm probably
But I concur already earlier. Yes.
uh, that was more of a self-reflection on me. And well, I'm not actually the best practitioner because sometimes my brain is in a multitude of places. So
Mm,
maybe the best person to see that client is the one that's most skilled in that area, and that's their sole focus, not part of their focus. So,
definitely. Definitely.
uh,
And look, and I think it's about what do you want your life to look like? What do you want your practice to look like? And for me, I consulted in private practice full time for 8 years before I stepped away. And the only reason that I looked to step away is because we decided we wanted to have a baby. And you know, and in having a baby, I can't be in the clinic all the time consulting. And it was, yeah, it was 8 years into the journey, and we went, it's time for us to do this. This is what we really want. And it wasn't I remember this really long search for this ideal EP. And they'd had to tick this box and this box and this box. And it wasn't until about a month before I was due that we actually found him. And that's Craig, who is still with me to this day in the capacity now of director of allied health in this organization, which is incredible. Um, but stepping away was not the long-term plan for me initially, like completely stepping away. So my goal was to actually integrate another practitioner and then come back and join and actually have a couple of us consulting. But what I soon began to understand is exactly what you were talking about, is that, when you have someone with a sole focus on patients, they're going to get great outcomes for patients. When you have a split focus, it's very, very difficult to navigate that. And you feel like you're always having a bit of a balancing act as well. And, I started bringing a young family into the world. So it wasn't something that I could fully commit to. And I had to make a decision around that. And as my first EP started to really take off and increase hours, and we moved into full time and all of those types of things, I began to understand the value in actually growing a team. And I fell in love with that idea of growing a team and supporting people with their life goals and professional goals in order to support our patients or our clients as well. And so that first hire, in a sense, it changed everything. But it was only really through that realization of I'm having a baby and I can't do everything. That was my sense of urgency. Um, I can't do it. So I need to stop. And it's funny. And I often think about those moments and similar moments throughout my journey where I've had that sense of urgency. And now I make it like almost a daily practice. Create your own sense of urgency, because you know what? Otherwise, everything just stays on the radar for about a year and nothing really gets done. So that was great bringing him on board. And to be honest with you, I didn't miss seeing patients all that much because I became so invested in my team and developing my team and doing professional development and growing out what can I do for them? How can this change the organization? And really being their advocates that it became less and less important for me to have face to face contact with patients anymore.
Yeah, at the end of the day, like we get into health because you want to help clients, you want to help patients and things like that. And some people do find that difficult initial stage of going, well, I'm not seeing patients or clients anymore, and I really like to, but realizing that you can still help your clients and patients by helping your team help them. So you can just do
Mm.
it on a bigger scale. So if that's how people need to see it or consider it in their own mind and change their mindset that they're still helping the patients or the clients, they're just doing it in a different way on a larger scale, then I think that'll help people just come to terms with it, I guess.
Most definitely. I think it's about the impact. It's about the realization of the impact that you wish to have as an individual. And if seeing patients is something that you absolutely love doing, I don't see why you should have to stop that. I found that I fell in love with different areas of, practice operations and growth strategies and supporting my people, which really was my driver to keep doing more, learning more, extending myself out of my comfort zone, and really being better at those things to really have more impact on those communities that I wished to serve.
Yeah. Did you have any crises where when trying to transition out of that? Obviously, necessity breeds innovation, and you had no choice
Mm,
but to do things. Obviously, having a child, and that's what you were talking about before. Is when you have no choice and there's no plan B, and well, I'm about to have a child, so just have to deal with the consequences of bringing somebody on board. And
mm,
at the end of the day, it's not as big a deal as often you made it out to be. Like that person comes on board and they're actually pretty good, and you're like, oh, they actually do half these things better than me
yeah,
in some areas.
yeah.
So what was I worried about? And then coming to terms with that after a while, that we did you have issues transitioning? Obviously, you enjoyed it, but from the outside, did other I guess did you didn't have any issues, but did other people have issues with you transitioning? Because I think that's a big concern
Yeah.
for people.
And I think that hits to a really good point. We were still so small that me transitioning out, we were such a small team. I think we had, one receptionist, one physio, and it was me. So me moving out, supporting someone else to move in, it was small. And I supported them very, very closely. I think that it may have been different. And for people listening to this that are perhaps having already grown quite a large team and are looking to transition out of that, I think that that might take maybe a little bit more thought and planning around how that might impact the other members of the practice, and also how long you've been treating for as well. It's funny because all of these years later, so I transitioned out in 2016, and we're sitting at 2023 now. Referrals still come through for me. They still come through. And we have a bit of a giggle about it now, but we say, hey, where's the opportunity to get in touch with that practice and talk to them about our other wonderful team members that we have on board now? But I think for me, it was quite a simple transition because we were still so small, and I needed to do it. And I think with a larger team, it may be a little bit more of a longer transition. I have definitely known of people that have done it, over 3 months, over 6 months, and slowly handing over clients and shutting their diaries to new clients for a period of time. There are certainly strategies, but I think getting support from a mentor or from people that have done that would definitely be helpful.
Yeah, absolutely. There's no real right and wrong way to do it. It's just finding the way that it works for you and
Definitely.
going with that. And I think from my point of view, like a level of transparency, like people come in and they see that, oh, I want to see Aaron. Oh, I'm not taking on new clients, or I'm not taking on clients at all because I've got these roles. And that. Like, oh, okay, no worries. And it's explaining that, look, I still oversee the team. I still support them. And that's how I frame it to some of the clients is,
Mm,
look, I'm still involved. I still support the team to help you best. So they feel like, oh, Aaron's still involved. He still cares about me. Then that's okay.
definitely.
And that's more so to explain it to the clients that have these concerns, and then their fears are allayed. And because me saying they're actually better than me at this type of thing, like, doesn't hold any weight. So like, "Oh, you've been doing it the longest. You must know what you're doing." Oh, oh, so
Yes,
honesty, like, obviously you wanna be honest and transparent, but on like, the full honesty of saying, "I'm actually not the best person,"
yeah,
doesn't hold the same weight, but still
definitely.
overseeing them and supporting them, but supporting your team help that. And when the clients realize that, they're fine with it, I think, over time.
Yeah, and I think still having visibility, in the environment as well. So, I'm not in every day, but the days that I am in, I float around our different welcome areas in through our consultation areas. I also sit and I talk to patients as well. They often don't know who I am, and we have a whole conversation, and they say, "By the way, what is it that you do here?" And I'll have a little chat to them about that. And it's the most wonderful conversations. And they'll say, "Thank you for taking the time to sit with me," because I love feedback. And that's the other thing. I value listening to people and understanding perspectives and experiences. And so you often find me floating through these hilarious starting conversations with people. If they ask me from the outset who I am, I will tell them. But sometimes I might just say as well, "I'm one of the practitioners here, and I'd love to understand how things are traveling for you right now. Would it be all right if we sat and have a bit of a chat?" And I love doing that. So just because you're not a practitioner, it doesn't mean that you need to be disconnected from your community that are coming in to utilize the service. Visibility, and as you mentioned, transparency, but visibility is paramount. It's something, your practice is something that you've created from a dream. You've moved the dream to goals, and you've moved the goals into a plan. You've broken that plan down into bite-sized chunks, and you're working through that. But it's always been your dream. So I think visibility for team members and for community is really, really important. And if you are doing things, as I mentioned before, I serve on some great non-for-profit boards, and I do a lot of stuff with some large key stakeholder organizations. I review research and literature and guidelines for quite prominent diabetes organizations. And we also make sure that that work that I'm doing is also displayed in the clinic and on the website and all those types of things, so that people that did know me, they understand that that passion is still being driven from a different angle. And there's beautiful respect from that as well. So visibility is really key.
Yeah, wow, that's amazing. You've definitely got a lot going on, and you just mentioned before about your diabetes organisations that you're working with. So, how did that
Mm.
come about, and why did that become a passion for you?
I'm 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 absolutely obsessed with supporting people that are living with and affected by diabetes, and it's all types of diabetes. Back to uni days, I developed my love for it when we had a lab. And I still thank and I give a shout out to Ken, who was a volunteer at the time at uni, who came in with type 2 diabetes and was on insulin. And we put him through all this rigorous exercise testing and all these laboratory measures, as you do as a postgrad student, and then prescribe him this home exercise program. And we started to see change in blood glucose levels and overall health outcomes in a really short period of time. And that was such a defining moment for me, going, wow, as an EP, I can have tremendous impact on a person's condition. This is not this is not just in a book. This is real life. And as I went into private practice, it was just an expectation, I think, from local GPs that within the chronic disease realm, that you saw people with diabetes. And I started to develop a real relationship with people and that condition. And I became a facilitator with the LIFE program. So, initiative, it's a government funded program, but Diabetes Victoria initiative to help support people living at high risk of developing diabetes. And I was trained in that, and I developed a love for diabetes prevention. Not all types of diabetes are preventable. Some of them can be delayed somewhat, but we need to understand that there are a myriad of factors involved in that too. So we don't assume that all diabetes is preventable. Um, but as I started to work more in that space and develop more training, I started to be invited to talk about exercise physiology and diabetes. And one of my first professional engagements was actually working with Diabetes Victoria. And this is probably about 10 years ago now, to talk at one of their events. And it was really, really well received. And I remember them saying at the time, it's the first time that somebody has come to talk about lifestyle without judgment, feeling really inclusive. And people just did not stop asking questions and they absolutely loved it. And they said, can we keep doing more work with you? So I started to write for them and started doing more work with them. And over time, I then started to develop a relationship with the National Association of Diabetes Centres, which is fantastic. And the more I wrote and the more I spoke and the more I treated, in that realm, I started to develop quite a high level of credibility in that area. And about 4 years ago, I was asked to then transition into a board member appointment at the Primary Care Diabetes Society of Australia,
Right.
which really aims to support primary care providers, to support people with living with diabetes. And what was really special about that is that society. I mean, it's an incredible society. We have a national conference, so we're putting together a national conference this year, which is really cool. So I've had to put my marketing cap on for that as well. But what was really great is traditionally that society had been heavily made up of medical professionals. Um, but now it has an exercise physiologist sitting around that table. And that is something that I am incredibly proud of. It's allowed me to create some relationships with some pharmaceutical companies as well. So I've traveled around Australia talking all things exercise and diabetes funded by some pharmaceutical companies, which is really wonderful, and really developing some great relationships because I'm really about the impact that exercise and lifestyle and also a team approach can have in that diabetes space.
Yeah, well, so the advice for any EPs in business is follow your passion, work hard at it, and you're going to get there. Like if people are not sure what to do as an EP or how to go about it in business, I think
Mm.
what I'm getting from everything that you've done, you just invested solely and you worked hard, worked your butt off with whatever resources you had available. Because at the end of the day, you obviously had pen and paper, you didn't have a computer, but people still saw you and you still grew it. So it's not about having the best available resources, but it's about
Mm.
having the right approach to help people. People want to know how they
Yes.
can be helped and how they can be supported, not what tools and technology you have. Like obviously tools and technology can help support your practice, but it's not the only thing that you should be doing, and you can definitely do without it, especially in the early phases of business until you
Yep.
develop into that.
Bring your passion. Bring your passion and bring your energy. And if you're thinking about starting a business and you're thinking, oh God, I don't have cash flow, I don't have this, I don't have that, reflect back on my journey. If you've got $100, you'll be fine. Mine was 110. So let's say 110. Do the side hustles. Do anything you need to do to generate the revenue to support your dream. Because if you're an exercise physiologist, you have an incredibly bright future ahead of you in the Australian health landscape. And private enterprise is one of those areas that you can make a huge impact, but you just need to believe it and be very mindful. Dreams are great. I was a dreamer. I'm a huge dreamer, but I'm also practical enough to do cloud time and dirt time. And that's something that my coach has been really working with me on in the last couple of years. Nicole, it's great to live in the clouds, but you've also got to have some dirt time. How do you get those ideas into a reality? Stop talking about these things and just take action. But the health landscape is absolutely ready for and prepped for exercise physiology and the multidisciplinary way of doing healthcare.
Yeah, so if people are looking to start into business or in that early stage of business, EP business specifically, what's your advice to them other than follow your passion and just go for it?
I think you also need to, so this is my business cap coming on now. Make sure there's a need for it because we can all follow our passions, but just by following a passion, what if there's passion but no market need for it? Identify gaps in the market, identify needs, and focus on providing solutions for identified needs. And then expand your loves and your drivers and adapt and mold things to fit where the gaps actually are, and also get yourself around really successful business owners as well. I surround myself with the most exceptional of people, and I guarantee you I am the dumbest person in the room most of the time, which I absolutely thrive in because I watch and I listen and I ask questions and I grow from it. So if you surround yourself with exceptional business leaders and entrepreneurs and all those types of things, and actually be careful with the entrepreneur side of things. I don't know if I really like that word, but around people that have got some runs on the board, and are really creative and innovative in their thinking. Um, Business coaches can be great. I prefer the idea of mentorship, and really helping to place yourself with a buddy, that can support you to grow and nurture some of your ideas because you just don't know what you don't know. Embrace that, accept it, and be prepared to grow, but surround yourself with some really great, exceptional, successful people.
Yeah, absolutely. You mentioned something. Obviously, you're not too keen on the words of business coaching and entrepreneurship. I definitely think the online space and social media has kind of skewed skewed
Mm.
those words for a lot of people. It Some people online go between entrepreneur slash charlatan online, and that's
Mm.
probably skewed the words of yeah. And you mentioned something before. Obviously, there's an identified need. You're not on social media trying to make up the needs just to sell a product. That's what I took from part of that because I thought there's a lot of people on social just making shit up just to sell a product.
Making noise, right? It's creating noise and focusing on their own ego. If you're a serious health professional that wants to be successful in a business space, don't make crap up. Actually look to solve problems. Bring your clinical expertise, bring your loves, your desires, and your drivers, and look for ways to blend that together to seek impact, not media space.
Yeah, absolutely. I love it. So what does the future look like for Nicole and all her things that she's got going on at the moment? Do you know?
Well, well, it's funny because I think about the infinite game, right? No finite mindset here, infinite game. So, where have we been, but what's now, what's next, and what's after that?
Okay, well,
But
what's next? Not the future.
that's
Let's
love
not
it.
say not the future. Let's say what's next.
What's next? So, we are growing some of our specialty services here, in our multidisciplinary practice. And what I'm really looking at doing is creating more visibility in the community around those specialty services so that we can help more people. We've spent, I would say, the last 6 to 12 months recruiting, onboarding, training, coaching, mentoring the most beautiful of energetic and kind health professionals that are really doing some great stuff in here. And now what we're looking to do is to bring our services to a broader market. So to be more known and even more easily identified in the market, for a couple of our specific services. But probably what I'm most excited about is I am bringing on a GP in our practice, which is incredible. And we have such beautifully shared interests in the prevention and complex and chronic sort of care management space. But in line with my passion, I'm going to have something around diabetes here. Um, we've created and we're about to roll out an Australian first program focusing on diabetes remission for early stage type 2 diabetes with the multidisciplinary approach of GP and allied health under our roof, which is going to be incredible.
Yeah, wow, that's amazing. I know we were winding down. I was getting to the last couple of questions, but you said something. Then hopefully you don't mind me asking you because I
Mm,
don't think I touched on it earlier. I know that I was going to, but you were EP first, and then you brought on
yeah.
physio, and now you bring on a GP. It seems the opposite of what's happening in the market. Like, how is an EP bringing on a GP? I don't think it's not meant to work like that, Nicole. What do you
I
what is
know.
what are
We're
you
we're
doing?
breaking traditional systems, aren't we? We're doing everything in reverse. I mean, What EP do you know that starts a physio practice and recruits physios and grows physios and then develops models of care for physio and EP to work harmoniously? I mean, who does that? We do. It's amazing. Um, but if we really want to care for people from that prevention space, acute injury management, all the way up to complex and chronic based care, you know what? We need the whole team involved. And the reality of this is that it cannot and does not happen overnight. So, we can't wake up one morning and say, I'm going to start a business and I'm going to do this, this, and this, and I'm going to recruit a specialist and then a GP is going to want to join. And the world doesn't work like that. You need to have the runs on the board to do it, and you need to have the credibility in place. You need to be able to have the evidence in place and really demonstrate, I think, sustainability in the marketplace as well, for people to start putting up their hand and saying, hey, I want to come and work with you. So, anytime we've looked to grow our health professional team, we've actually had members of those disciplines put their hands up and come to us and say, hey, love what you're doing in this space. This is how I think I might be able to value add. What do you think? Then we start to have a conversation. Um, and there's been many a time where opportunities have come to us and I've said no to them as well. It's not about having somebody of that discipline come on board and celebrating that and they not be the right fit either. So we've had plenty of people in varied specialist positions saying, can I come and work with you? And I've said no, because it's not been who we are or where we're going and it's not values aligned. But we're getting some great professionals coming forward now. And there is another discipline that I'm speaking with at present that looks like we're going to be having some really great contributions from that discipline as well as we look to scale our specialist services.
That's amazing. It's definitely a lot harder to say no to some things early on, but it's also important what you say yes to, but also what you say no to go in the direction
Mm.
that you want to. And that's part of the tough conversations or uncomfortable decisions you will need to make as a business owner, but it's okay.
Definitely. And, putting everything through filter. So we are purpose driven, values led business where all of our decisions are put through our filter of mission, vision, and values. And I think as you have more of as you become more established in business and you have those things really, really clear, decisions also become easier too. So I have no issue with saying no to things anymore because I put it through my filter, take it to my team, we put it through the filter again, and we decide. And now it's more frequently no than yes.
Yeah, it's amazing. I love your work, Nicole.
Thank
So
you.
where can people find you online if they want to reach out?
Yeah, most definitely. So, website, I mean, we've got exerciserehab.com.au and essendonphysiogroup.com.au. You can jump on either of those sites and have a bit of a look around to see a little bit more of what we do in our community impact and advocacy and all those types of things. And you can certainly shout out, do a little contact us form or anything like that there. But you can follow any of our work or any of my work on LinkedIn. I love it when people jump on LinkedIn and they want to connect, so connect with me on LinkedIn. And I'm also on Instagram. So I think it's Nicole French _EP. It could be. I don't know. If you search for that, you'll probably find me. Or yeah, jump on LinkedIn. I'm not huge on Instagram these days. I just prefer to use my time in other ways. So I
Yeah.
I pop some things up on there, but you can certainly, send me a PM. But it would be great if you jumped on our websites and had a bit of a look at what you wanted to do. And if you need any help with steering you towards coaching and any of that sort of stuff, I can certainly point you in the right direction with really credible business coaches as well. That have nothing to do with me. I don't have anything in that realm. I do the do. I'm the passion, I'm the love. I don't do any of that, but I have some amazing people that I've worked with over time that I could certainly point people towards depending on where they are in their level of business and what they're after as well.
Yeah, love it. I just looked up Nicole_French_EP at
There you go.
Instagram, but as well, that's not the place that they're probably going to find you too often anyway. So it's best off reaching out at the other places. So I'll preface
Thank
that whole
you.
conversation by saying that's what it is. Also, don't go there first if you
Love
want
it.
contact. So that's okay. Well, thanks for jumping on. It was I think I, I, I'm sure that a lot of people listening will get a lot of value. I know that I did. So it was great that we were able to go down a multitude of different paths, and appreciate your work.
Oh, thanks so much. Thank you for supporting me to come on today. It's been beautiful to have a chat. And anyone starting out in business, you've got this. Get excited. You've got it.
Awesome. Thanks so much.
Pleasure.
You've just listened to another episode of Ex Phys Biz. If you've got some value out of the content, make sure that you like, share, follow, or subscribe. Until next time.